talks are going to be recorded, while the Q&A will not. But now I would like to welcome everybody and to this special case event, which I'm very glad to be chairing. We hold this event in order to mark the launch of the report on the case on the material deprivation review, which was published back in late March. This report is the outcome of a 2-year project, which was commissioned to case by the WP, and I think it's a very useful result. Anyway, yes. So the case team working on this project was led by Abigail McKnight, our director here at CASE, and included people, several other people, Tania Burchardt, who is also co-director at CASE and associate professor at social policy at LSE, Irene Bucelli, who is a case researcher as well, and myself, I'm also a researcher here. And now, today, we're very glad to have Lottie with us, with whom we worked the last 1.5 years, I think. Yeah. And Lottie is going to will present first to give us the DWP's perspective for the development of this new revised material deprivation measures and the review of this. And then we're going to move on with 2 presentations by case team. And we'll start with Tania, who is going to give us talk about, a little bit later. Yes, now I'm handing over to Lottie.
Cool. Thank you. Just hopefully I can use the clicker. Okay, perfect. So hi everyone, I'm Lottie Devaney, and like what you said, I work for Department for Work and Pensions. I'm a statistician, and my team in various iterations led kind of the commissioning of this review of the UK Material Deprivation Measures. And I'm going to just give a super quick overview of the background, like what prompted this review, and then we'll talk a bit about the aims of it, and then I'm just going to hand over to the other speakers who are going to talk about all the interesting work and findings that came out of it. So we commissioned this review in December 2021, and these UK material deprivation measures are collected in our Family Resources Survey, and we produce estimates for children, working age adults and pensioners in our Households Below Average Income publication. And this is a national statistic, and it's an annual one, and it's used extensively across government and externally. So one of the reasons why we commissioned this review was because it's required as a national statistic by the Code of Practice for Statistics to review national statistics regularly. And none of these measures had been reviewed for over a decade, so it was kind of due to be reviewed. But we also received a number of recommendations from the Office for Statistics Regulation, and they included a recommendation to review the items that underlined our current UK material deprivation measures, and also to look at if we could determine a way to compare material deprivation across groups, because we currently produce these like individual level estimates. The aims of the review are on the screen here, but the main 4 are to explore which material deprivation items for families with children, working age adults and pensioners we should include in our Family Resources Survey. Then the advantages and disadvantages of different ways of determining material deprivation, and the advantages and disadvantages of developing this core set of questions for the whole population alongside those aimed at the individual groups. And then the final one is whether the advantages of updating the material deprivation measures outweigh the disadvantages. The findings from the review were published alongside our latest Households Below Average Income publication on the 21st of March 2024. And like it says on the screen, today's seminar covers kind of the key findings from the review, including the revised material deprivation measures and proposed changes to collection methodologies, recommendations in relation to all the different approaches to determining who's materially deprived. Cool. So this slide just summarises kind of the key elements of the review. So it started with an evidence review and then qualitative research with focus groups to help identify this like long list of items we might include. These were then tested in our family resources survey from April to June in 2022. And then we conducted, well, I didn't conduct, but the researchers conducted analysis of the test question data, a series of statistical tests, and from this came a list of different recommendations around how we might change the items, and then also the advantages and disadvantages of the different approaches. Like I said, we publish our Households Below Average Income publication on a yearly basis, and it has a year lag. So we included these kind of revised items in our FRS survey year 23-24, which has just kind of finished being collected. And once we have that data, we'll be able to analyse it to create our new material deprivation estimates, which we will publish in March 2025. Alongside that, we'll also publish details of the decisions that we've made as well. And that's everything that I was going to talk about. So I believe
yeah. Thank you. Okay. Now we have Tania Burchardt, who is going to talk about our working definition of material deprivation that we had as a basis behind our work.
Yeah. Thanks, Eleni. Yes, absolutely. So we thought it would be helpful just briefly to say a little bit about how we understood what the concept of material deprivation was that we wanted to operationalise with DWP through their measure of material deprivation. Looking at the names on the screen and the faces in the room, I think this will be familiar to many of you. But the idea of relative deprivation, of course, is commonly traced to the work of Peter Townsend in Poverty in the UK, where he grounded a concept of relative poverty in an idea of material deprivation. And the definition that it's given on the screen there is one version of how he expressed that idea. And I think the key elements in this understanding of what poverty is, understood through a frame of relative material deprivation, is that it is about resource constraints. So you can see in the definition there that it's about people who lack the resources to participate in society more broadly. A second key feature is that the deprivation we're talking about, what people are lacking, are necessities. They're things that are necessary for people to participate in society more generally. Thirdly, that this isn't just about material goods. Although we talk about it as material deprivation, it isn't actually only about consumer goods, material goods. It's also about activities and amenities. So obtained types of diet, for sure, that's a material aspect, but also participate in the activities, have the living conditions and amenities which are customary. And then finally, that it is, of course, a relative definition. It's relative to societal norms. So absolutely embedded in this concept is that it's the customary, widely encouraged or approved activities, amenities, material well-being for the society in question. So that, of course, has a number of implications for how you want to then operationalise that idea. And we use this representation to try to communicate where we see this idea of relative deprivation sitting in amongst the plethora of other poverty, social exclusion and deprivation concepts that one can find discussed in the literature and indeed in other survey sources and so on. If you like to picture this as a spectrum of living standards, from more deprived at the left to more comfortable at the right, we're seeing our relative deprivation measure sitting in the middle there. It's distinct from lacking what you need to actually survive: food, shelter and clothing. That's really an idea of destitution, such as has been captured by the Joseph Rowntree Foundation measure developed by Suzanne Fitzpatrick and colleagues in collaboration with JRF. So relative deprivation is not destitution. And as I think Irene will say a little bit more, that was a distinction that we needed to keep coming back to with our focus groups for the qualitative stage of the research. Equally, it's not about living comfortably. So we're not talking about luxuries. We're not talking about comfortable living. We're talking about a minimally acceptable standard of living. Acceptable being defined, of course, through what is socially acceptable in this particular context. So that can be captured by the idea of necessities, but it's necessities for an acceptable standard of living, not necessities just for bare existence. And that, again, I think is an important distinction. The work that's been done on minimum income standards by the Centre for Research and Social Policy at Loughborough, again funded by the Joseph Rowntree Foundation, I think it's also really operating in this space. It's trying to capture this concept of an adequate standard of living, but it's a very different approach in terms of what the measure itself is capturing. So the minimum income standard is a comprehensive measure of everything that somebody might need in order to achieve that standard of living, translated then into a budget, an amount of money. What we're looking for here is instead a indicative set, a set of indicators or markers that give you a good proxy for identifying people who are at risk of material deprivation, material relative deprivation. So it is not intended to be a comprehensive measure. It's not intended to mean that if you have these things, you are not deprived, and if you lack these things, you are deprived. It's about an indicative set that will help us to differentiate between the materially deprived and those that are not. So that's how we understood our task, to identify an indicative set of socially perceived necessities for an adequate standard of living, which taken individually and combined satisfy a number of tests, which Abigail will say a little bit more about in due course. And so we broke that down into a series of steps. First of all, what items and activities and amenities do the general public perceive to be necessary for a minimum acceptable standard of living? And we approach that both qualitatively and quantitatively. Then an examination of who lacks those necessities and what the constraints are. What are the reasons why they lack it? Is it a lack of resources? Is it other constraints, such as lack of access to a particular amenity, or perhaps through health or disability or other types of constraint? Or do we want to look at this simply as something that people either have or don't have, without reference to the explanation, the reason for those constraints? And then thirdly, reflecting on, given who we've identified as lacking these items or amenities, who should we count as deprived? Which constraints count in which contexts, and what sort of threshold and how might we go about defining that? And those stages were both conceptual and statistical. So I'm going to hand over now to Irene to tell you about the qualitative stage of the research.
Yes, thank you, Tania. And just briefly, you notice the dates, so you'll not be surprised that we conducted our focus groups via Zoom. We had 13 focus groups and 61 people were involved, and we had different focus groups for parents, different focus groups for working age adults without children, older people, and also some focus groups with young people. So 12 of those 61 people were young people aged between 12 and 18. And we also had some mixed demographic groups at the tail end of our qualitative work, where we did some more cognitive testing of the items and the questions that we had developed. We also take care to recruit people with a range of different characteristics. Participants were from the 4 UK nations. There was variations in terms of income, in terms of, for example, ethnicity and disability status, and so on. In total, we discussed 103 questions, and we divided these in 10 categories. So financial security, where we would discuss debt, savings, so we would discuss insurances and pensions, home and living conditions with several household items, but also whether they were being able to keep the home adequately warm was considered a necessity, or whether having damp and other features of the house were considered to be not acceptable for a minimum standard of living. Health, communications, where we discuss internet and phones and so on. Mobility, where we discuss transport. Food, clothing, social and leisure activities, items and activities specific to children, and things for oneself. So things, for example, is having a small amount of money at the end of every week or every month for yourself necessary for an acceptable standard of living. And these 103 questions were based on an assessment of a much longer list of 252 items that we had drawn from a range of sources, from the current FRS to the EU Silk, the Poverty and Social Exclusion Surveys, and the Minimum Income Standard. So we use some Zoom functionalities for this, meaning that we presented these questions to our participants via Zoom polls. So participants, for each category, they would first assess these items divided into different categories. Not all categories were assessed in each focus group, because you can imagine there's way too many. So 4 or 5 categories were assessed per group, and they would individually say whether these items they thought they were necessary or not for an acceptable standard of living. And these results were then shared with the group, and they were the discussion starting point where we could articulate why we thought certain items resulted to have gained a lot of support and others didn't. And then we were able to also probe the questions and understand how the participants had understood the questions. So we were able to see how they understood the questions as they were presented to them before we discussed them, and then we could discuss at the end of the discussion. So how should we frame this to better capture what has been the essence of the discussion? And I give you an example of how we say here the polls basically evolved throughout. Questions were dropped, questions were added, participants were able to add questions. We tried in later focus groups to include this, and the wording changed. So for example, at the beginning of our focus groups, we included both this regular savings for rainy days from the FRS and the coping with unexpected expenses from EU Silk. And we found out that talking of rainy days really didn't scream necessities to our participants. They thought this was about luxuries instead. And they all agreed that coping with unexpected expenses was essential, but there was ambiguity about what this coping means. If you're taking on debt to cope with unexpected expenses, that can put you into trouble. And so we created a new question that said savings to cover unexpected expenses. And what we found out is that apparently savings was considered not really realistic. They thought it's not possible to have regular savings at the end of, for most people, at the end of every month to cover unexpected expenses. And some participants that had experience in giving financial advice or had received financial advice suggested we'd try the emergency funds. And they even gave us very detailed explanations of how much should go in these. And eventually, the item that was included in the test question was having money aside to cover for unexpected expenses. So this is just to give you an example of how these questions evolved and took on board what the participants told us. I will not go through many of the findings for each of the categories, but just some overarching findings. We really saw the importance of framing, meaning that when we start with a definition that says what is necessary for an acceptable standard of living, then in discussion, people start talking about necessities. And as Tania hinted at, this is often understood as something you could not live without. And when you cannot live without this, then it brings the conversation to shift into a destitution or severe deprivation rather than the relative deprivation that we were interested in. Because people assume, well, cannot live without this. So they drifted into thinking about items that are necessary to survive, like food, clothing, like basic shelter. This is linked to the phenomenon of adaptation as well that we really witnessed in our focus groups, whereby participants often discounted their own experiences of deprivation. And that meant that if I have done without this, I'm maybe doing without this, or I have done without this in the past, it cannot be necessary for an acceptable standard of living. So people these views in relation to, well, holidays, saving central heating or flooring, that's where conversation even in front of a group that was discussing how having adequate floor is important for health and safety. People say, well, in the whole year while I was expecting my daughter, I did without any floor covering. So clearly it's possible to go on without. We also saw that the pandemic had we were in the height of the pandemic, but it was having a clear impact on the items that people valued, for example, internet access in terms of being able to work or access education and maintain social contacts. There was also emphasis on access to devices, both because families had to deal with loads of children sharing devices and the discomfort that caused, but also it was very much in the media, and even those without children had this perception of what was important. And so on, for access to green spaces, for example, or various social activities and holidays. And again, the impact here is not necessarily in one direction only. So, for example, in relation to holidays, some people said, I really see the value of having a break now that I've not been able to leave the house. And others said, well, we've been able to live well without having a holiday. So clearly it's not a necessity. And there were also other cultural shifts that participants identified. So, for example, some of the questions that were included in some of the sources that we had used included new, not secondhand clothing. And people said, well, actually, secondhand clothing is preferable because, for social reasons and reducing waste and environmental reasons. And also because there are new platforms and ways of seeing and exchanging clothing and so on. And that also applied to other topics such as having healthy lifestyles. So a lot of emphasis on balanced diets that people thought was much different than in the past. Also the value of mental health, which prompted people to really value items that were, for example, related to financial security, connecting this to the impact of, for example, living with debt has on mental health. And so with all this, what we did is then we, as a team, individual members, evaluated and assessed the items, and first individually, and then we shared our assessment with the other team members on the basis of a number of criteria. These focus group poll results that we had, qualifying this because obviously sometimes people had misunderstood questions, so that's why some results were the way they were. The qualitative data that was collected, but also information about existing sources that are on the percentages of people agreeing that certain items are necessities, existing evidence of prevalence, so the prevalence rate in the window in relation to some of the items already existing, whether items were subject to a variation in taste that was likely, whether items are likely to be specialist to a very particular subgroup of the population, whether they were similar items were included already in the UK Material Deprivation Measures, Also, whether items had a high or low value. So, for example, if you have a big ticket item or a recurrent cost, as opposed to a very small cost, their relationship with the other shortlisted items, and the evidence from their evidence review. And with this, I will pass on to Abigail. They will tell you what we did with this 35 selected test questions.
Right, thanks, Irene. So, as Lottie mentioned at the beginning, we were able to test these items on the Family Resources Survey by including these test questions in a special module in the months of April, May, and June 2022. Then we got the data back in October of 22 and conducted a whole series of tests on those items to work out then in terms of thinking about shortlisting. So, I mean, this is written up at length in the report, so I'm just going to go through some of the tests that we employed to do this, and this is an analytical framework which is now quite widely used for developing material deprivation measures. So we look at suitability of items. So not only did we ask people in focus groups, but we also specifically asked people in the Family Resources Survey to identify items from show cards that of our 35 items, which of those items they considered to be necessary for a minimum acceptable standard of living in the UK today. And so then we were able to look at the percentage of survey respondents who agreed to that item. We use a quite slightly higher benchmark than was used previously. In the past, 50% is used as a sort of majority, as just a majority of respondents who agree items are necessities. We think that's a little bit low, and it can create problems if you're just above the 50% mark. So we actually employed a higher cut-off at 60%, which you'll see from the report that our items is just a couple quite close to that, but the majority have got a higher support than that. We also looked at validity, so whether items are valid indicators of material deprivation, and then we assessed this in using regression models to estimate the correlation between lacking an item and other independent variables. We used low income and low savings. We also test the reliability of items and of the overall scale. So when you put all the items together in a scale, we use item response theory models to assess the severity and discrimination of each of the candidate items. And also we use a measure of internal consistency of a scale. So the complex alpha, again, widely used. And alpha provides an estimate of how closely related the items are as a group. You can also use it to see what's the impact if you omit one of the items, and does that coefficient, alpha coefficient, go up or down depending on what you do. So these all help us to identify items which are promising in terms of including in a revised measure. We also look at additivity, so that tests whether the more items you lack is indicative of greater deprivation. So you want to make sure that adding items, you're not including items, add up together and indicate greater deprivation. Of course, that's what our scale is to do in the end. Now, our sample size in our FRS data set was around 10,000 overall abundant responses that we can use. So it's a significant size data set and bigger than ones that have been used in the past when the measures were derived. Obviously, that varies for different groups. So some of our analysis was done for the working age group, which is the largest sample size, over 5,500 children and pensioners. I'm not going to go through all of the results. They're all in the paper for people who want to read those, because I think people are going to be more interested in looking at the revised measures. We can take questions on to the end of this one. So in creating the revised measures, we looked at the test results. So I think it's very important to be upfront here. There's no single objective measure that's going to identify which items you should include in a measure of material deprivation. Material deprivation itself is a latent construct. And there isn't another perfect measure that you can compare it with. And so you're always going to be looking at a whole battery of tests and combining that with expert judgment in reaching a decision about which are the best items to include and how well they work together as a composite measure. And of course, all of these tests that I've outlined, many of them actually use rules of thumb. So again, there's not an objective reason to accept or reject. And we use two categories of failure and borderline failure of those tests to try and do it. And again, drawing on previous literature, which you'd use those tests to do that. So we also had a project advisory group and a steering group. We consulted them, and we were grateful for the input we had with them in terms of how we select our items, and came up with the revised material deprivation measures. And then we've got some joining us online today, which is great. So the factors that we took into account in terms of shortlisting our items were the number of test fails or borderline fails. The item costs, whether these are very expensive items, they cost a lot, whether they're very cheap items, or whether there's in fact actually some items which you can substitute things which are free. So one of the things we found in the focus groups, people say, oh yes, well I like to do this, but it doesn't cost me anything to meet with my friend in the park, for example. There's a very cheap alternative and so on. And of course, those very cheap or free alternatives don't work very well in a measure, because effectively they don't add anything, and people can find an alternative that doesn't cost them anything, and therefore there's little point in including them. You want to include some lower cost items, you want to include some more expensive items, but you don't want a predominance of one or the other in the measure. So other evidence on prevalence. So we were able to look at prevalence in the FRS, but we also had other published evidence from other measures on prevalence. How common is it for people to have these items? The broad or narrow relevance to particular groups, for example. Whether an item is likely to be affected by tastes and preferences. So again, that they're not necessarily good indicators then of material deprivation for the population or the age groups that we're interested in. We did look, and as Irene outlined, we did look at dimensions. We didn't take a dimension dominant approach in selecting items, but we did have some idea that we wanted to cover key dimensions, whether that's food security, social activities, and so on. But we didn't use that by itself to say we must have one or two items for each of these dimensions, but we did have some consideration of the dimensions. And whether inclusion would help in the development of a whole population measure. So that could be important where an item doesn't appear to be working so well for specific groups, but you want to include it in the overall measure so that if you can develop a whole population measure, or you want to be able to compare deprivation between groups, you might keep that measure in and ask all groups, even though if you were looking specifically for an age group, you might not include that. But there are some examples, and there's written up in the report of some items which didn't appear to be working so well for specific groups. That we decided to include overall. Now, I think it's important that we acknowledge that revising measures creates breaks in series. That's a nightmare for us social scientists. We want to know what's happening over time. We want to be able to track changes over time, and of course, the new measures are going to be coming in around. We've got the cost of living crisis and everything. That's a break in the series. And so that's a real cost to revising these measures. But the old measures really had got quite outdated. You can't just say, well, we're going to, just for the sake of continuity, not revise the measures, but they're no longer working very well. So the benefits of revising the measures were updating the component necessities. And also, we're going to talk about this a bit further, about the data collection methodology that we've recommended some changes, so the way the FRS collects data on material deprivation. And you have to weigh these up against the impact of the discontinuity. I would say this is actually against a backdrop where the COVID-19 pandemic already disrupted really all of the poverty time series. So there was already a discontinuity. So in a sense, that was a backdrop, I think. And we established very early on that there's no point in making just small changes to the measure, because if you make small changes, there were small changes made to the child material deprivation in 2010. It created a break in the series. It's a break in the series. And just changing a couple of the items, if you're going to revise a series, you might make wholesale improvements to the series. look at everything, the methodology of collecting the data, how it's structured, which groups you might be asking specific questions on, and so on. And we weighed up those, the downside against the improvements, and came to the conclusion, made a recommendation that the UK Material Deprivations measures should be revised, and this was accepted by our steering group. Now, so just in sort of, in terms of the high level changes to the measures, so as Lottie said, to start with, there are 3 different measures currently in use for the UK, published in the HBAI, which is for working age adults. That was a new measure actually introduced in 2023. I'm going to talk about that a bit further in a minute, so I'm not going to say too much about that now. And there's a measure for children and a measure for pensioners. Pensioners measure was introduced in 2010. I'm going to say a bit more about that too. At the sort of summary of aggregate level, you can see what we did. We actually introduced 2 separate blocks of questions. One at household level, where there are 11 items, and these are common to all age groups. So it's a common set, 1 adult in each household responds to these questions. So it helps to reduce the survey, the burden of the survey on households. So these are things like, is your home damp-free or not? And that applies to everybody in the household. You don't need to ask everybody in the household whether their house is damp-free or not. And then we had age group specific individual level items with some harmonisation. You'll see what I mean by that. But beneath these summary changes, so first of all, what you can see is that for working age adults, there are now 21 items and activities, while previously there were only 9. For children, there's 22 versus 21. Pensioners, 19 versus 15 in the previous measures. But beneath the surface of this, there are quite substantial changes, which I'm going to go into. The revisions also included changes to the data collection methodology, which I'm going to talk about, to improve both the quality and the reliability of the data collected and harmonisation across age groups, because actually we were collecting data for pensioners in a different way than we were collecting it for working age adults and children. And that's just sort of historical. This is the way these things developed over time. They've never all been looked at together. The pensioner measure came in 2020. We didn't at that time make the decision to revise the children and working age adult questions. And so it went off and it was slightly different. So we're bringing these all together in terms of having a similar method. Now, so I'm just going to show the changes for the working age adults. So this is the previous current measure for working age adults. And there are 9 items. These are the questions which are included on the Family Resources Survey. It's a bit of it's slightly ad hoc, the working age adult measure, because it's the adult questions which are included in the Child Material Deprivation Measure. And so they've never really been tested whether they work very well for working age adults as a set. But they cover quite a broad range of items. So enough money to keep your home in decent state of decoration, having a holiday, household contents insurance, some savings, and having a bit of money for yourself, keeping up with your bills and keeping your home warm enough. So those are the 9 in the previous measure. Now this is, okay, then we have got a problem with our screen. Probably okay for people online. These are the 21 items that are now included in the working age adult material deprivation measure. The 11 household level items at the top, and then the 10 individual level items at the bottom. So the household level items, and I'm not going to go through this order, you can see that now this is a fairly extensive set of items that are included for the working age group. Household level items, as I say, include damp-free home, being able to keep your home adequately warm, and some really new ones about everyone in your household having access to a computer or a tablet, everyone in your household having access to transport that's reliable, timely, safe and affordable. A new item there for the measures. Having reliable access to the internet at home, and again that came up in the focus group, so it had to be at home that you had reliable access to the internet. And then the individual level items, again we've got some here that are similar to what we included previously, but some really new ones: regular payments to workplace or private pension, eating 3 meals a day, fresh fruit and vegetables, appropriate clothes for work or job interview, regularly attending dentist appointments, a break away from home rather than a holiday away from home. That came through very strongly in focus groups. And we know from previous analysis that the holiday question really doesn't work very well. And what people say is you need a break. And previously, the question was not staying with family. And people said, and there's no doubt post-pandemic, that actually staying with family is a really important thing to do. Why would we want to exclude that? So it's a break really away from home. And then some social activities, going out socially once a month, seeing your friends and family at least once a month, and having some money to spend on yourself. Now, what does this look like overall for our 3 groups? Well, these are the household level items, so it's a common across all of our age groups. The 11 household items. And what I've done here is I've shaded the box so you can see which items are new, so they weren't previously included in the measures for these age groups, and which are sort of slightly revised versions of existing measures. So, for example, being able to put money aside for unexpected expenses. In the working age and children's measure, there was a question about having regular savings of £10 a month for rainy days or retirement. I don't think £10 a month is going to get you very far for your retirement. But the focus groups are very clear that there shouldn't be an amount in there. They couldn't agree that there should be a specific amount. But for pensioners, there was, can you pay for an unexpected expense of £200? So there were slight differences between groups, and we've harmonised that to put one question for all of the groups about having money aside for an unexpected expense without saying what that amount should be. And then there was a question on transport for pensioners, but not for working age or children. And the pensioner one was having access to a car or taxi whenever you required it. And so you can see that these, some of them, sometimes they're very completely new for the group. Sometimes it's about harmonising between the different age groups. So we've got the same questions coming through in terms of the household level. That affects everybody living in the household. So we retained some, we revised some, we brought some new ones in, and we dropped some of the old ones. When we look at the individual level items, this is specific to the age groups, you can see here that for the working age group, which was the much smaller number of items in, of course, we've got many more new items there for the working age group. For children, not so many new items. But there were some changes in terms of wording and so on. And then for pensioners, some have been revised and some new ones brought in, and some we retained. Now, one of the things to note here in terms of what we did is that the working age group and the pensioner group have the same necessities included in the measure, apart from the working age group having appropriate clothes for work or job interview and regular pension payments, which are not relevant to the pensioner group. But you can see there's this strong harmonisation between the adult population. We didn't find when we tested specific age-related items for pensions, they really didn't work well. They didn't resonate with the focus groups. They didn't work well when we tested them. We tested some specific health items and so on. They really didn't work well. And there are 3 items, individual items, which are common to each of the age groups. That's 3 meals a day. So that's new for working age and children. There was a question for pensioners previously, which is about having at least 1 filling meal a day. The focus groups were about, well, actually, we don't want to feel full. You know, it's important actually to have 3 meals a day. And they said, well, should that just be for pensioners, for children? No, everybody should be able to have 3 meals a day, not 2 meals a day, or not 1 filling meal. And again, fresh fruit and vegetables, that was included previously for children, came through in the focus groups and tested very well in the FRS data. But actually, this is important for every group, everybody should be able to afford fresh fruit and vegetables every day. There were alternatives to fresh, but they're very, very cheap options available. And so in a sense, we want to set the bar a bit higher. It's more expensive to get fresh, and therefore it's a better indication of material deprivation if you can't afford to buy fresh. Not necessarily a difference in terms of the health benefit. And so those three and an annual break away from home are common across the three age groups. But then there are some very specific measures, particularly for children there, which don't apply, of course, to working age adults or pensioners. You don't want to lose those in terms of picking up material deprivation. Now, the review, as I've mentioned already, also led to some changes in data collection.
So just a quick question while it's up. The one thing that really strikes me is, so regular dental appointments isn't something picked up for children. Is that because there is an assumption that they can get free NHS treatment and that they can get appointments?
Well, yes. I mean, of course, things have actually moved since we started this project. It's got even harder to get a dental appointment. And if you were doing it now, you might want to be testing that for children as well, because it's clearly an issue. I think if the parents are having trouble getting a dental appointment, then the children definitely will be.
Yeah, so you can make some inferences there. Okay, sorry.
No, but it's something actually when I was putting together the table, I thought, yes, well, really, we should have perhaps included that for the children there as well. So getting onto the data collection methodology. So as I mentioned before, we had differences in how we were collecting the data for working age adults and children and pensioners. Now, this is the previous method, and I've sort of just summarised it here, in that it was a one-step method. In the Family Resources Survey, there was a question used to establish the lack of material deprivation items, and it was just this one question in relation to each item. We or I have this, we or I would like to have this, can't afford it, where I do not want or need it at the moment, or that it doesn't apply. And then if you would like to have it, but you can't afford it at the moment, that's considered to be a financial constraint. Items which are lacked due to a financial constraint in terms of establishing material deprivation status are then weighted using preference weights. I'm not sure if I've got time to go into preference weights here in the presentation. There's a lot about it in the report. We can pick it up in the Q&A. Preference weighted scores are then summed for each of the individuals. Scores are standardised, so they're between 0 and 100. And then if the standardised score is greater than the set threshold, which was previously 25 for working age adults and children, and individuals classified as materially deprived. All sorts of things going on in that black box that we might want to unpick. Then for working age adults and children, and I have time to get onto this, if they're materially deprived and live in a household which is below a low income threshold, either 50%, 70% of the median, then they're considered to be poor. Now, this measure for children, this combined measure for children, there's a legal requirement for DWP to publish this, so the Welfare Reform Act and or previously the Child Poverty Act is a requirement to publish those statistics for monitoring. Originally to hit Labour target to halve child poverty and reduce it within a generation. Although the targets have gone, there's still a legal requirement to publish those data. So that's working age adults and children. If we look at pensioners, so this came in, again, this is slightly because of the history of how these things developed. But there was a two-step process introduced. So pensioners were found to be reluctant to say that they didn't have items because they couldn't afford them. So this method was introduced to try and solve that problem. So first of all, they're asked, do you have this item, yes or no? You don't know, you're going to be asked why. After you've answered all of those questions about whether you have items or not, you'll then, for any of the items you say you don't have, you're asked why. And you're not just asked about whether you could afford it or not, or don't want it or not, or don't need it. You're asked whether there are other constraints affecting why you don't have that. So, future health or disability, too much trouble, too tired, I haven't got anyone to do this with me, and so on. And so this concept of wider constraint is important because it is a bit different from material deprivation. Wider constraint is used for determining which pensioners are materially deprived or not. And there's a slightly different threshold, so a threshold of 20 used for pensioners there in terms of their standardised prevalence weighted score. So what we did, what we recommended is now on the Family Resources Survey is a standardised approach for working age adults and children and pensioners. We've used a harmonised set of reasons, what we call reasons for lacking. First of all, everyone's asked this yes/no question. Then when you've answered all of those, for any of the items that you lack, you then ask for the reason why. One of the reasons why these are separated is that if you put them together, so if you ask first, yes, no, do you have this item, and then ask the reasons why, survey respondents look for shortcuts. Don't we all? And so if they know they're going to be asked the second question, if they say no, then they're reluctant to say no, because I'd rather get through the survey. Been there for half an hour already. So you're slightly tricky then. So you're not letting on, you're going to be asking them why to start with, but then you'll for each of the ones if they know to do it. So this is to improve to try and reduce our underestimating material deprivation through this. So we're improving the data collection methodology overall. Financial constraint is used there for establishing it's slightly different. And again, this is drawing on the reasons for lack of use for pensioners, slightly reduced. So it's only 6 options available now. But all of those, the 2 that we dropped, not having someone to do it with and being too tiring, really weren't being used when we analysed the data. And they can collapse into another reason. There's nothing really coming through for those options. So there's no need to include them as extra ones. Now, I would say that some of the items, and I'm not going to go through short, but some of the items are measured simply on simple absence, whether you have the item or not. And that's damp-free home is a good example of that we introduced. That it doesn't really matter. I mean, you've got a damp-free home. I mean, the reason why your home is you're living in a damp home is irrelevant to material deprived of a damp-free home. So for pensioners, continue with the 2-step approach with a wider constraints, so a wider range of reasons why you might lack an item that's used. Now, so then we did some further work. I've just got 5 minutes.
5
or 10 minutes.
Yeah.
To talk about some of the other work sort of at the end of the report, see, but just as important, and still there are decisions to be made about this, looking at assessing different approaches for determining who is materially deprived. So we looked at how to determine optimum material deprivation thresholds. So as I've said, we've got different ones used currently for pensioners and children and working age adults. They will need to be rebased with these new items, the new methods for collecting and so on. And we give some recommendations about how DWP, we couldn't do this in the test question data. The FRS data from 2023-24 will be about 3 times larger than the test question data set as a minimum. And you need those data in order to be able to rebase the thresholds. Critically important where those thresholds are, because it determines who is materially deprived or not. We also looked at the advantages and disadvantages of prevalence weighting items and of different types of measures. I'm just going to say very briefly there that the reasons for prevalence weighting came in because of there was an assumption that if you lack an item that the majority of other people have, you're going to feel more deprived. But if lots of other people also lack it, then you're not going to feel so deprived by not having it. Now, and the second reason is if you keep your items fixed for, say, 10 years, that prevalence can change over time. And so therefore, it's a way of sort of keeping the measure up to date with those societal shifts going on in terms of norms. However, it has got disadvantages. One is in a recession, when more people are going without an item, just because of more people are going without it, you're still just as deprived. So, for example, if we use the case of living in a damp-free home, it doesn't matter that 20% versus 10% of people are deprived of a damp-free home. So you might want to give that a prevalence weight of 1, or maximum weight, for example. And also, it's slightly complicated because of the standardisation process, that it's not only the prevalence of how the prevalence changes over time, of a single item, but how that's relative to prevalence changes for all of the other items included in the scale. So it's a little bit of a black box that needs to be looked at. Now, if you don't prevalence weight, you're much better off just using a simple count or summation measure. That's saying, I lack 10 out of these 21 items. To start with, that's much easier to communicate. It's much simpler to compute. And it has greater face validity. If you can say to people, look, these people are deprived, they lack 10 of these 21 items, and they say, oh, I lack 12 of those. So I understand what that means in terms of my life. If you say to them, well, these people are deprived because their prevalence weighted material deprivation score is more than 25, very difficult to understand what that might be. So unless prevalence weighting is really significant, and we've made some recommendations type of work that you might want to do in order to see whether that is important or not, you're better off moving to a simple summation measure. And in fact, when we look at the data, although it looks like it was brought in because you think you can have finer grain distinctions from the way you set the threshold, it actually, it's lumpy anyway. It's not a continuous variable. And it usually comes in at there's quite a clear cut-off in terms of the number of items in the black. I'm going to say a little bit about combining material deprivation status with a low income indicator, and if I have time. We also looked at simple absence versus constrained lack, and also aspects of the whole population or household level material deprivation measure. So if we just look at the combined measure. So as I said, there's a legal requirement to publish a series for children. And what it means is that we're looking at children who are both materially deprived and living in a low-income household. And this is obviously the previous measures with different items. There's a break in the series at 2010. The top orange series is for children less than 70% of poor housing cost income. So that's our relative income poverty line for children. The blue line, the dotted line, shows material deprivation for children. And the bottom solid line, blue, is this combined measure, materially deprived and low income. So you can see that's a subset of those who are materially deprived, because not all of those who are classified as materially deprived are also living in a low income household. This was introduced because there's some concern that individuals classified as materially deprived, well, in fact, in higher income households, have different tastes and preferences. So they're spending their money on other things that don't have any money left for the necessities. Their tastes and preferences differ, they prioritise other items. However, it's important that the social sciences say that this conflates two very different concepts. We have relative income poverty and material deprivation, different things. One's a direct measure, one's an indirect measure of poverty. When you bring them together, what does that mean? Now, this you can see in terms of trends over time. So you see the trends, they do follow different trends. Obviously, the combined measure is close to the material deprivation measure, but I want to highlight one particular period here, which is just after the financial crisis. So we know that relative income poverty estimates fell over that time, and that's because the median fell, the poverty threshold fell, and so therefore it looked like poverty was falling. Well, according to this measure, it was. Now, obviously, there's some concern there because if people's incomes haven't changed, in fact, they might have fallen. We know that absolute measures or anchored measures of income poverty actually increased over that time. Now, if we look at the material deprivation series, we might think, well, material deprivation is a perfect measure to turn to in times like this, because we know what people can afford to buy with their income. We can see that's the dotted line that material deprivation increased. When we turn to the combined series, the published series, it looks like poverty fell amongst children. Now, this is a concern in that it's sort of masking these what you'd like to know about what's happening with material deprivation over that period. Now, DWP do make the material deprivation solo measure available on their static score. but it's not that easy to access, and it's much less likely to be reported in the media and so on, because you'd require journalists to go to Stat Explore, take the series out and so on, rather than just looking at HBAI and what the series are presented and the sort of headline rates. So we made two recommendations in relation to the combined measure. One is that there's a legal requirement for children at least to publish that. So unless you overturn that, then continue to do that, and there might be some interest in that combined measure anyway. But we're recommending that DWP publishes the new HBAI headline series on material deprivation, not just including it in Stat Explore, but actually publishing it in HBAI. So we can do that analysis in terms of crisis or recession, what's happening to material deprivation and that. We're also, I mean, this is sort of other related aspect in terms of income. The material deprivation combined measures use before housing cost income. We're saying it should be after housing cost income. It's much more realistic measure of the resources available, and it's also consistent with other HBAI series. It's there as a legacy, really. It dates back to when material deprivation combined measures first introduced in the early 2000s. Right, with a couple of minutes, and I'm just going to say a little bit about the whole population material deprivation measure. What we looked at here, and again, there's still a lot to be done on this. I'm not going to go through everything in here, but clearly you've seen from what I've presented so far, there are still important differences between the different age groups. So specific child-related items which you don't want to drop. There are differences in how you look at constraint for pensioners versus working age adults and so on. So to produce a whole population all age measure, we've helped move in that direction by increasing the standard data collection method, so you can look at different types of constraints across the whole population, a common set of household level items, some which are individual items which are common for the working age adults and pensioners, who might be able to look at an adult, all adult measure. But there are these key differences that combine that really you've got to overcome. What do? Do you use financial constraint? Do you use wider constraint? What threshold might you use? If there are different thresholds are found to be optimum for the different age groups, how do you come to terms with that? If you set the threshold too high, then you might then underreport material deprivation for some groups, and whether you combine it with low income or not. There's analysis in the report, but this is on doing estimates, trying to sort of flex some of those, try those different aspects out. So what if we use constrained lack for everybody? And these aren't optimum thresholds. We haven't done the work in identifying our optimum threshold. They're sort of continuity thresholds, if you like. So you see the different rates of material deprivation if you use constrained lack, if you use financially constrained lack, if you combine it with low income. Or at the end, one thing you might want to think about is, are they additive anyway? I mean, if these are the best measuring material deprivation of different groups, can you actually add them up across groups? And so our all age estimate, if you take that approach, is to say it's about 14.5% material deprived. I don't want to get too fixed on what the numbers are in here, because in a sense they're not on optimum thresholds, but they do allow you to see how these things influence different estimates, those choices. How important. So we made a few recommendations to DWP about the additional work that would need to be done if you move to a whole population measure. And then, I mean, just to say, so the report's now been published, and there are a few critical things which remain to be done. So the new questions, as I said, were in 2023-24. We actually got a split sample, so split 75-25. 75% of the sample will be asked the new questions, 25% of the old questions. That will help us understand the break in the series and might help us in terms of determining the optimal thresholds. But from 24-25 will only be the new questions. As Lottie said, it's going to be published in 2025 HBAI. So those are going to be our first estimates. Before we get there, the optimum thresholds need to be determined. There's quite a lot of work to be done on that. And also some work on whether prevalence weighting is necessary or not, or should we just move to a simple count measure. Thank you.
Thank you. So it's now time to move to our Q&A session. We're going to start taking questions from the online audience.